The circles of sexuality will be discussed in this presentation. This model, holistically addressing human sexuality, was created by Dr. Dennis Daly, a social worker, and it reflects 5 different circles that overlap to some degree, and they include sensuality, the body touch feel of sexuality, intimacy, the interpersonal connectedness of sexuality, sexual identity, who am I as a sexual being, sexual health and reproduction, the blue light special, that is the one that gets all the attention related to things like contraceptive technology, pregnancy, and reproduction, and sexualization, how do I use my sexuality? As you can see, they all overlap to some degree, and in fact, this particular presentation isn't quite as reflective of the overlapping experience of them because they actually should all be touching each other, but just so that you can see them all, they were presented this way. But sensuality affects the blue light special, sexual identity affects sexualization, etc., etc. Sensuality, body touch feel of sexuality. It reflects the awareness, acceptance of, and comforts with one's own body, physiology, and psychological enjoyment of one's own body and the bodies of others. In other words, it's a lot about body touch feel. It includes 5 or 6 different concepts: body image, human sexual response cycle, attraction template, skin hunger, and fantasy. I will briefly just touch on these. Body image is the notion of how we feel about our bodies and how we feel when we look at ourselves in the mirror, and how we think of other people's bodies as well. This, of course, can have both a positive and negative outcome. Positive outcome, of course, is a great sense of self-esteem. When one maybe feels sexy, they feel good about their body in all kinds of ways. And, of course, some of the negative outcome has to do with a toxic relationship that sometimes culturally we have in towards our bodies, the negative messages we give to ourselves about our bodies, as well, and unfortunately clinically can result in things like anorexia nervosa and bulimia nervosa, as well as other forms of eating disorders. Human sexual response cycle is the physiological response of human sexuality to arousal. Many different theorists have in fact addressed human sexual response. Probably the most well known are Masters and Johnson, as well as Helen Singer Kaplan, and they addressed it in the context of seeing what happens to the body when people become aroused, including the stages of desire, excitement, plateau, orgasm, and resolution. Attraction template basically is your type, the kinds of characteristics that you find attractive in other people. And that can include things like physical presentation, looks, personality, sense of humor, charisma, both tangible and non-tangible characteristics. Skin hunger is the longing and desire to be touched. That is the aspect of connection that people want to be touched in some ways. I usually frame this in 2 ways. One is a pickle tub, which is basically a large pickle tub, a barrel that a lot of water can be poured into. So if you think about it, touch as water, you pour a whole lot of touch into a pickle tub, and it takes a lot to be able to fill it up. And so someone who's a pickle tub with skin hunger is going to want a lot more touch than someone who is, say, a pickle jar, which of course is much smaller and takes a lot less. I'll talk more about that in week 2. And finally, fantasy, that would be the psychological and often symbolic and or emotional experiences that arouse a person. Intimacy. If sensuality is the body touch feel of human sexuality, intimacy is the interpersonal connection. That is, relationships, the ability and need to experience emotional closeness to another human being and have it returned. That includes a number of concepts: caring and sharing, liking and loving. These 4 all interact in some way. And I'm going to concentrate primarily here on love. Love is, certainly one of the strongest emotions that human beings can have. And in the context of the experience of love, people experience often, according to Sternberg, intimacy, passion, and commitment in varying degrees. That will also be discussed in week 2. But loving is one of those experiences where if you've ever seen somebody who's just falling in love, you often know the kinds of behaviors that they can engage in, whether they talk to somebody on the phone and they do all kinds of ooshie gushy talk, and no, you hang up, no, you hang up. You know what I'm talking about. So the idea here is that that's a really powerful factor. It can also change people's behavior. Someone can be happily married, have a great job, home, all that kids, all that kind of stuff, and leave it all to fly across the country and hook up with somebody they met on the internet. That's a really powerful behavior modifier. So love and liking is a big part of it, and caring and sharing is something that you share with yourself, with other people that you care about. Risk-taking and vulnerability are hand in hand. You can't have intimacy without risk-taking. You can't have intimacy without vulnerability. And the notion of what it means to be able to be vulnerable with other people is a big part of it. In terms of the challenge here is that sometimes people who struggle with intimacy often have experienced hurt, and that's because they've been vulnerable with other people in the past and either have been treated poorly or experienced trauma or something along those lines. The kicker is you can't have intimacy at all without being vulnerable to other people, and that involves taking risks. And finally, self-disclosure and trust. Self-disclosure, of course, verbal and nonverbal and behavioral ways of expressing and sharing parts of yourself. So you can see that these things are, in fact, connected. And trust, we could go back to Erik Erikson's perspective, the notion of the world is a safe and okay place to be. It's intimacy, interpersonal connectedness. Sexual identity, who am I as a sexual being? In other words, taking a look at one's sense of gender, one's sense of orientation, and their identity. And there's a series of different concepts under that. This will be discussed much more later in this class. And that includes, but isn't limited to, gender, is related to core gender, gender role, and gender identity. To start with, let's take a look at biological sex. Biological sex is different than gender. Biological sex is the body that you're born into, your biological package, your anatomy, your physiology, your genetics, your hormones, all that kind of stuff. Your core gender, however, is your inner sense of gender experience, like how you feel on the inside. You feel like a man, you feel like a woman, or perhaps you have a different experience of gender. And oftentimes, biological sex and gender match, but not always. Gender role has to do with the behaviors that are often proscribed or prescribed in our society about, and often they're traditional or non-traditional, way that a man should behave, a woman should behave. And as you can see, it's often set up as a binary, that is, two and only two experiences or ways of being with regard to gender, and that sets a difficulty. Now, what we know about gender role is that has changed over time. For example, a woman can now be a parent, but also have a career. Does it mean that there aren't barriers to being successful with that? No, of course not. There are barriers, in fact, but that has changed over time. And gender identity has to do with what we call ourselves. Again, the language that we use often reflects the binary, that is man, woman, he, she, boy, girl, when in fact we know when someone's biological sex doesn't necessarily match their core gender, that is their inner sense of gender, who I am on the inside. Sometimes that changes and people feel differently, and that's what we often call trans. We'll talk more about that. Sexual orientation refers specifically to who you fall in love with or who you're attracted to. We distinguish that as well from sexual behavior and sexual identity. Sexual orientation, often our sexual identity is the language that we use, again, for what we call ourselves, which, of course, in our society and culture, we often refer to as heterosexual, gay, lesbian, bisexual, queer, and in some cases, pansexual, asexual, and things of that nature. Sexual identity, who am I as a sexual being? Whoop whoop, the blue light special. Sexual health and reproduction. This basically is what folks are supposedly taught all the time in sex ed in schools. That has to do with how babies are made, reproductive health, conception, pregnancy, and birth, as well as different aspects of sexually transmitted infections and unintended pregnancy. These are the factors that are often covered in different aspects, reproductive facts, how babies are born, how conception happens, what are some of the factors that involve fertility, what are some of the impacts of that, physiology and anatomy, feelings and attitudes about all those behaviors, so how people feel perhaps about infertility or how people feel about pregnancy, or in some cases how people might experience if they experience a sexual dysfunction, for example. What are some of the feelings and attitudes in terms of that experience? And finally, of course, contraception and risk reduction. Contraceptive technology incorporates the kind of barrier and or hormonal methods or behavioral methods that might reduce the likelihood of conception during sexual behavior. And finally, risk reduction behaviors that people will engage in to reduce the likelihood of any kind of unintended pregnancy or sexually transmitted infection transmission. Sexual health and reproduction, the blue light special. Sexualization, the use of sexuality to influence, control, or manipulate others. This is how we use our sexuality. And these involve flirting, seduction, withholding sex, sexual violence, and sexual harassment. Flirting and seduction, of course, are the art, if you will, and science of romance, but it also can be used negatively as well. That is, someone can flirt with another person to try to get their attention in order to maybe, get them to buy someone a drink, if we define negative intent as the desire to use or control someone else or manipulate them with our sexuality, that would be framed as a negative intent. Or flirting can also be to try to get the attention of someone that you're attracted to. Seduction is similar. It often a series of behaviors that people engage in order to try to express interest or engage in sexual activity with them. Withholding sex, a lot has to do with recognizing their own sexual limits, what's okay, what I do want to do, what I don't want to do, where are my hard lines, where is something that I'm willing to explore, experiment. And of course, it also can be used with a negative intent, with the intent of sexual blackmail, if you will. You're not going to get any sex until you take out the trash, kind of thing. And then, of course, sexual violence and sexual harassment, negative intent, the notion of issues related to incest, sexual abuse, rape, sexual assault, sexual exploitation, objectification, sex trafficking, which cause tremendous trauma and damage in a lot of aspects. Sexual harassment, of course, is the use of power and position to manipulate or control others, often for the purposes of things like a promotion, a better grade, etc., etc. So I will note that sexual violence in some cases, some people might frame bondage and discipline, sadomasochism, or BDSM as sexual violence, when in fact it's considered something different in the context of safe, sane, and consensual, and we'll talk more about that later on this semester. There is one more circle, though, I want to bring to your attention, and that is probably what I consider the most important circle, and that is values. What your values are in relation to the circles will skew or how you view them all. How do you view touch according to your value system? How do you view relationships? When is it okay or not okay to have sexual behavior? How do you view sexual identity? What are the values that you have about sexual minorities? Blue light special, what are some of the values you have about contraceptive technologies? Sexualization, how do you feel about, what are some of the values you feel about how people who are, for example, perpetrators or sex offenders should be treated in society according to social work? So you can see that the values lens is really significant in this sense. And ultimately, it requires us to be introspective and sexually literate and emotionally literate practitioners, engaging in the counsel and social work education's charge to self-reflect and subsequently self-correct. I want you to critically think about your values with regard to sexuality, because as I'm guessing you might assess, the things that we've covered by addressing the circles of sexuality were not often taught in formal education or even discussed in our homes. Oftentimes people learn about human sexuality from the playground, nowadays from the internet, from their friends, etc., etc. And oftentimes that information can be flawed and shape our values. So I want you to think about, where did your sexual values come from? Where did you hear those messages? How did you come to believe them? And how will these values influence your work? That is probably one of the most important questions that I will ask you in this course. How will this influence your work? And what steps are you going to take to address those values to engage in ethical, culturally competent social work practice around sexual values? I hope this presentation has been helpful. Thank you.